Hi everyone, my name is Gary and I'm a respiratory care practitioner in Los Angeles, California. If you are new to my channel, welcome, and if you are a previous subscriber, this has been a really long time coming. YouTube has not been my main focus, so make sure to follow me at GaryRT on Instagram. That is where I post quizzes, study guides, study advice. You can follow me around during a day-to-day work life. I post some informative things about ventilators or ABGs, and yeah, I am the first respiratory care practitioner FIGS ambassador, so you can get a discount with my code FIGSTimesGary and save some money with that. But this video, I wanted to talk about 5 things that I love and 5 things that I'm not necessarily the biggest fan of when it comes to respiratory, so these will be some pros and cons, so let's get into it. So the number one thing that I like about respiratory is just patient care. I love being a part of so many different people's lives in just one shift. You know, as respiratory therapists, we are all over the floors, the ER, the ICUs, the step-down units, the med-surg units, the telemetry, everywhere. We are literally on every floor of the hospital in just one shift, and we get to work with all age groups, and so that's really nice. So being able to work with a variety of patients and being able to see them get better, whether it's giving them a breathing treatment, make them feel better, or weaning them off the ventilator and putting them on a more simple O2 device and then eventually seeing them go home is definitely the number one pro to being an RT and working in healthcare. So the second thing that I love about being an RT is just that adrenaline that comes with a code blue or a rapid response or any sort of RT page. When they say, hey, this patient's desading, and there's just, you get nervous, you get excited, and to be a part of a rapid response team or code blue team and to be that person that everybody is looking to for help, for advice to save this patient, it's a really rewarding feeling. It's just, I don't know, I can't explain it. It's just really rewarding and crazy that people are looking up to you to make these quick decisions and in very intense moments. So just that adrenaline and having to be quick on your feet and people relying on you and just getting in there and getting out and doing what needs to be done. I really like that aspect about respiratory. The third thing that I like about respiratory is that there's such a camaraderie and teamwork that comes with being an RT. We are dealing, I don't think a lot of people realize just how much that we know. So we are dealing with some really critical patients, and you really have to critically think and think physiologically and what could be going on with this patient, what else can we do to help this patient. And so you're working really closely with the physicians and with your nurses and with the PAs and with your fellow RTs to try and come up with solutions, and it's just really nice to be able to piggyback off of physicians and nurses and your coworkers who trust you, and to just think maybe we should give this patient some Lasix, maybe we should increase the PEEP, decrease the PEEP. You're constantly having to do things that are altering other things that are going on with this patient. So if you make one decision, it could affect their blood pressure or their heart rate. And so just having this great foundation of knowledge is really nice, and to have people trust you and respect your opinion and to respect your decision. I really like that about being an RT, and yeah. So my absolute favorite thing, I mean, maybe it's not my absolute favorite thing, but one of my favorite parts about being an RT is just being able to go all throughout the hospital. I could have telemetry, and I could be the ABG RT, and I can have some ICU patients in just one shift. And I really like that I'm not stuck sitting with just a couple patients, or you know, I just really like that I get to move around and be a part of multiple people's lives, and just really think differently for each patient and really deal with different types of patients and what's going on with them. And yeah, so being able to run around, and I really like that aspect. So the fifth thing that I just love about being an RT is obviously the pay. I feel like we are generally compensated nicely. I think, you know, some days, some nights, it's super busy. You're nonstop on your feet. You barely have time to go to the restroom. You barely have time to take your lunch break. Maybe you didn't take a lunch that day. Maybe you have to stay overtime to help out day shift. Maybe it's just a crazy day. But there are also days where you are having less patients, less treatments, it's a little more relaxed, there's no codes, there's no rapid responses, you have some downtime, and especially those days when it's really slow, you're like, wow, I get paid to do this, you know, and it's just really nice to finally be able to get paid after, you know, being a student for so long, going to however many rotations that you go to. I went to 5. And so to finally, you know, get paid for going to school for this is just, it's a really nice feeling. And yeah, it's really nice pay, especially in LA. So definitely don't go into respiratory just for the pay. I definitely did not go into respiratory just for the pay, but it's definitely a nice thing to live comfortably, and I'm happy with respiratory. No, I do not want to go into nursing. I'm just happy with respiratory. So there are downsides to being an RT, and some of that can be either from certain people at your facility or certain groups of people at your facility, or maybe you're not going to experience this at your facility at all. Maybe it's just going to be a couple individuals that you come across every now and then, but some people just do not respect RTs, and I think that comes with just the lack of knowledge of what we are aware of. We went to school and we learned a lot of different things and a lot of really important critical things, and so some people just, you know, love RTs and respect your input, and some are just like, I could do what you can do. So you're gonna come across people who might not like you, but that can happen anywhere with any job. So the second thing that I don't like about respiratory are the long hours. They can definitely get to you. You are working, you know, most likely a minimum of 3 12.5-hour shifts a week. You know, some of my coworkers are working like 12 days a pay period and just working nonstop. You know, sometimes you're working 5 days in a row. It just all depends on what you are wanting to pick up or the need or whatever, but it can be very exhausting, especially when you're working night shift. So for example, let's say I work tonight and then tomorrow morning I would get off, and I might have tomorrow night off, but technically I'm working during the morning, so you're always kind of working on your day off, and unless you have more than one night off in a row, it kind of doesn't feel like that much of a day off. And so especially working night shift, it can be really exhausting, and you are you know, not on the same schedule as your family or your loved ones, so that might be a little difficult for some people. But I actually like night shift, but definitely just the hours in general, especially when you're like super busy being on your feet all day, it can be exhausting, it can be tiring, you're gonna be sore, but I like night shift, and generally it's not too bad. You're gonna be tired at other jobs too, but it is pretty physically, emotionally, and mentally demanding. So the third con, I would say, are that there aren't very many avenues you can go as an RT. Don't get me wrong, there are avenues that you can go, but there's not as many as other careers. So you can become a lead RT, you can become a manager, a supervisor, but if you have your associates in respiratory, or if you have your bachelor's in respiratory, or if you have your master's in respiratory, you are most likely going to get the same pay. So there's kind of no really big motivation to up your education besides for personal gain. So definitely if you want to be like a manager or a supervisor, you want to have those higher degrees. But yeah, those higher degrees are definitely not necessary. Some people go to career colleges, some people go to community colleges, some people go to universities, and we all work together, so your degree definitely does not matter. You do get pay increase with experience, but not necessarily with a difference in degree. Although some facilities may prefer a bachelor's, or it may look better to have a master's if you're interviewing against someone with just an associate's, but who knows, that could all be biased. But yeah, so there's not very many places you can go where like a nurse could become a nurse practitioner. RTs, we are already respiratory care practitioners, so that's kind of the end of the avenue. Some people do become RNs or PAs after being an RT, but yeah, with respiratory, there's not too many things you can do. You can do home care, you can become a PFT RT, you can do travel RT, you can go into the NICU and PICU, or you can be like a flight RT. But yeah, there's not too many crazy different avenues that you can go. Fourth, and probably the worst thing about being an RT, is just being in healthcare and dealing with patient deaths, dealing with sick people and seeing them get worse. And you know, I think it's especially really heartbreaking when you have patients that you get so emotionally attached to, and you know, you were with them while they were awake and they were talking to you and they're squeezing your hand and they were telling you this and that and they thought they were going home soon, and then you know, the next night they code and you're doing CPR and then they die, or they code and then they're on the ventilator, and then you know, weeks later they're still on the ventilator and they're not coming off and they're not getting better, or they become brain dead. It's just, it can be very, very sad, and I have, you know, really, really sad personal patient stories, and it's just, you know, at the end of the day, you have to realize that you did everything that you could do, and it's, you know, not your fault, but you just really have to do your best and care for your patients and try not to take that stuff home with you. And yeah, so that's definitely a really terrible thing that I don't like about healthcare in general, I guess you could say. And the last thing that I guess kind of ties into some other things that I've said, but the job can just be pretty stressful. You know, you could be running around so much in one day, you can be super busy doing all these transports, there's all these codes, you have really critical patients, you might be short-staffed, you might have like 15 breathing treatments to do on top of everything else that you have, and so some days the workload can be a lot, it can be stressful, but that's why you have your lead staffs for help and you have your coworkers, and you know, you just try and do the best that you can do. In general, I absolutely love being a respiratory therapist. I love my job, I love my coworkers, I'm really grateful for this. I recommend it highly for anybody to go into respiratory. And yeah, so those are 5 things that I like and 5 things that I don't necessarily like about being a respiratory therapist, but besides that, I pretty much like everything, and I really enjoy it, and I hope that you do too if you're looking into going into respiratory. If you have any questions, or if you want to follow me along more on my journey as an RT, if you want some quiz advice, anything, follow my Instagram, instagram.com/GaryRT, GARRYRT, and if you are looking to buy some fig scrubs, use my discount, Figs times Gary. I'm very just appreciative of all of your guys' support, and you know, you guys have been with me from the very beginning, so it's just really crazy that before I was, you know, just looking into the program, and now I'm an RT for a year, and I just thank you guys for following me along my journey, and I appreciate you so much. So if you like this video, subscribe, follow me on Instagram, and I will see you next time.